Do you have pinching pain in your upper back, shoulders, your neck? If that's you, this video is for you. We're going to share with you 3 key ideas of what you need to do in order to get rid of that pain. And you could have woken up with that pain, or that pain could have developed over many days. Either way, this video is for you. You don't need any equipment. You can do those exercises right at home, and we want to share them with you. Hi, I'm Dr. Mimi, chiropractor in Walkersville, Maryland, and this channel is about giving you tips and strategies for revitalizing your back and neck health so that you can be without pain and live your best life. If you want to receive these videos, subscribe to our channel and or tap the notification bell so that you don't miss out any of the weekly videos. This pain is often radiating, and often people don't know what to do about it. The challenge with neck pain is that often it's getting worse and you don't even know about it. People call this cervical radiculopathy. Oftentimes it's not necessarily a pinched nerve. The nerve can be compressed or it can be irritated and cause a variety of different symptoms. And so we're going to share with you these three ideas right now. So before I get into the exercises, I'm going to explain what is happening. Oftentimes when people have a pinched nerve, it comes with a wide variety of symptoms. It could be pain radiating down the arms, it could be pain radiating in the neck, and it's called a pinched nerve. The nerve may not necessarily be pinched, and there's an array of symptoms that may be causing that. That pinched nerve, it could be irritated or compressed, and it can be debilitating. A person with a pinched nerve may have a variety of symptoms, including numbness, tingling, even weakness at the arms and the hands. Often, when somebody does have a pinched nerve, they often want to be less mobile, less active, and that can create more of a problem because it can cause muscle wasting and less blood flow to the areas. So you want to not be stationary. You want to stay active if you have a pinched nerve. A pinched nerve in the neck can be caused by many different things. It can be caused by microtraumas, such as holding a phone against your ear, holding children on your side for many hours of many days. It can be from sports injuries, even from many years ago. Also, a fender bender, anything more than 8 miles an hour. Also, posture and poor posture, whether it be a poor sleeping posture, a poor standing posture, that too can cause pinched nerves. So the 3 exercises that we're going to share with you, we're going to do right now. The number one is called the median nerve slider. With the median nerve slider exercise, what you want to do is you want to extend your arm out, and while you're extending your arm out, you want to drop your head to the opposite side and pull that arm down and then bring it back. So you want to bring your arm out and drop your head to the opposite side. That's stretching out that nerve. And you want to hold that for a count of 10 while you're doing this. Make sure you're breathing. Of course, once you do that on one side, you also want to do it on the other side. So you're going to bring your arm out and drop your head away and hold that for at least a count of 10. Do it nice and slowly. That's going to stretch that median nerve. This is called median nerve rocking. The second exercise you want to do is you want to put your hands together in prayer position. It's also going to help relieve that numbness, tingling in the arms, the upper back, shoulders. And when you're doing this, you want to press those wrists together, press the arms down, and then you want to push the elbows to the right side, and then you want to push the elbows to the left side, and you want to hold that for a count of 20. So that's the second exercise for relieving that pain in that median nerve. The third exercise is neck, shoulder shrugs and rolls. So what you want to do is you want to bring those shoulders up to your ears and then bring them down. So you want to hold that up for a count of 10 and then drop it down. That's going to relieve that upper back, that neck tension, your shoulder tension. So you're going to just bring those shoulders up and down. The second part of this, is shoulder rolls. So what you want to do is you want to bring your shoulders up to your ears and then bring them back and then drop them down. While you're doing that, you want to squeeze those shoulder blades together and try to fully relax those shoulders. You can do it forward and backwards. Again, you're going to bring those shoulders up and around and drop those shoulders. So you want to do that in both directions. You could do this for about 2 minutes every hour. That's going to reduce a lot of the stress in your upper back and your shoulders. So if this neck pain doesn't go away with these exercises, consult a chiropractor. The chiropractor will take some x-rays to find out if you have any arthritis, how long it's been there, what they might need to do to get the situation corrected. They may also create a game plan of what you need to do to stop the pain so they can stop the arthritic change and let you live your best life and maybe even change your posture so that it can alleviate issues down the road. If you want to get more tips and strategies, watch this next video that we're going to teach you some ideas of how you can get a better night's sleep and go to bed with less pain and get up with less pain in the morning in your neck.